dottoressa Palma Ciaramitaro, sono contentissimo di presentarla io perché lavora con me e presenterà appunto questo modello di percorso multidisciplinare della chiari con la siringomelia, di cui lei ne è responsabile. A livello regionale speriamo che arrivano poi i fronti. Grazie.
Ringrazio. Ringrazio sicuramente Laura Valentini per l'invito. In realtà ho il compito di stare nei tempi perché sono l'ultima e avevo preparato una esposizione in inglese in onore degli ospiti stranieri che andrei a fare, scusandomi sin dall'inizio se il mio inglese non è così fluente. I shall be going to speak on Chiari and Siringomelia Consortium, like a model of a multidisciplinary and sharing path for rare disease. This year there was the second International Rare Disease Day in February with this target, patient care and public affair. Let's see how we can try to overcome this challenge. But first of all, what is a rare disease? According to European Union action plans, rare diseases are life-threatening diseases, chronic disabling, with a low prevalence to require particular joint collaboration to prevent significant premature morbidity or mortality. That is a relevant reduction in the quality of life or in the socio-economical potential. In Europe, a prevalence threshold of 1 in every 2,000 individuals has been chosen. From 5 to 8,000 different rare diseases have been diagnosed in 15 million people in Europe alone. The Italian legislation defined a list of rare diseases for which sufferers are free of payment for medical assistance, according to the Italian decree 279/2001. I'm going to speak to you about several topics: the Italian Network for Rare Diseases, the Piedmont Valle d'Aosta Network for Rare Disease, Chiari Malformation and Siringomelia Consortium, and last but not least, the CTO Multidisciplinary Group, CTO, the hospital where I work, to deal with these diseases. Rare diseases are a priority for public health in Italy. In 2001, a specific national law set up the Italian National Network for Rare Disease and established the Rare Disease National Register at the Italian National Institute of Health, Istituto Superiore di Sanità. This decree shows you the code that people affected by Arnold-Chiari syndrome can use to obtain completely free of payment for care and treatment. It's important that is a syndrome, Arnold-Chiari syndrome, with the specific neurological signs, and not only MRI malformation, Chiari malformation criteria. This slide to show you where is Piedmont, number 1, and Valle d'Aosta, number 2 in Italy. These are two specific regional decrees for Piedmont that were made for Piedmont and Valle d'Aosta. And the first one, in 2004, set up the regional network and obliges the hospitals to report all rare diseases to be registered, and established the Regional Center for the Coordination of Rare Diseases. Second one, regional decree in 2005, set up a technical committee to work in collaboration with the Regional Center for the Coordination of Rare Diseases, and includes a further 50 rare diseases, including Siringomelia, with this specific code. And in fact, to date, Siringomelia is recognized as rare disease only in Piedmont and Valle d'Aosta. This is a schematic drawing that shows It shows how registration and exemption takes place. The patients with rare disease are reported to the database, who informs the coordination board that works as a register, and in turn the Italian NIH. The approval is given by the medical legal board for the execution of the payment. This diffuse network in the Piedmont model is unique in Italy, and established that all the regional health system specialists are involved not only in the diagnosis, but also and above all in the follow-up and treatment. The crucial point of this model is the consortium, that is a multidisciplinary group operating throughout the region, made up of volunteers, physicians, biologists, and their care workers. Every 3 months, several topics are discussed at dedicated meetings. The purposes include the promotion of working groups for research and discussion of clinical cases amongst physicians. And then the development of shared protocols with the aim of setting up standardized diagnostic therapeutic approach. In 2008, the Technical Committee for Interregional Rare Disease Network approved the Chiari-Syngomelia Consortium. These are the code, one for the Syngomelia. This is a regional exemption code, and this is the code for Chiari syndrome, national exemption code, all over Italy. The objective of the consortium are different: to compile and adapt interregional diagnostic criteria, to develop a dedicated interdisciplinary and shared interregional diagnostic therapeutic path, to define the prevalence of Syngomelia and Chiari malformation in the Piedmont and Valle d'Aosta regions, with particular emphasis on different diagnosis between symptomatic and asymptomatic forms, to promote research groups, and to improve the collaboration among patient associations and physicians, and to favor the relationships with the national and international scientific societies. The organization includes compiling and adapting diagnostic therapeutic guidelines based on scientific evidence and protocols, with the aim of developing an interregional shared interdisciplinary diagnostic therapeutic path. The informative didactics is made with a questionnaire for general practitioner and specialists, meeting courses, and Chiari-Syngomelia epidemiologic and clinic database to complete the rare disease register for epidemiologic and clinic public health purposes. For example, the incidence, prevalence, premature morbidity or mortality, quality of life, disability. Research is made up analyzing and studying familiar forms according to clinical phenotype, neurophysiological study of neuropathic pain and Syngomelia with painful symptoms, with the hope to have more information about innovative pain therapy for Syngomelia. And we should also like to propose an international database network for Chiari and Syngomelia. This is a multidisciplinary group in CTO Hospital, since 2008. This involves many branches of medicine and care: neurosurgery, neurology and neurophysiology, neuroradiology, physiatry, spinal surgery, phoniatry, and the others. With the aim to identify diagnostic therapeutic protocols, to set up a diagnostic therapeutic assistant path, not only pre-surgery but follow-up, early and long follow-up, and multidisciplinary team evaluation for patients with doubtful diagnosis or to select patients for surgery. This is the diagnostic therapeutic assistant path that starts with the neurologist in a dedicated outpatients department, and after involves the other specialists. To put it in a nutshell, this is a schematic assistant path, only to just to take you an idea what happens when a patient presents with a diagnosed or only suspected diagnosis of a rare disease. First of all, the neurologist makes the diagnosis, makes or confirms the diagnosis, and a confirmed exemption is given. If not, if in the cases of preliminary diagnosis, temporary exemption is supplied. Will be confirmed by the multidisciplinary evaluation unit made of all the specialists we saw in the previous slide. If the diagnosis is confirmed, the definitive and confirmed exemption is given, and if not, once the diagnosis is not confirmed, temporary exemption is not renewed. Well, what we have done to date is of course a drop in the ocean, but the ocean can also bring to joint in a collaborative research project. To conclude, a big thank you to Giuliano Faccani and all my colleagues from the CTO Multidisciplinary Group, and of course from the working group of the Chiari and Silicomedia Consortium of Piedmont e Valle d'Aosta. Thank you very much.
Grazie a questa tempi alla grande. Io sono di parte, non posso fare domande. Ce ne sono domande? Allora, auguriamoci che poi il suo modello possa venire preso ad esempio da parte degli altri. Okay. Grazie ancora Palma, io lascio la parola